Have you ever chalked up your constant bloating, fatigue, or unexpected menstrual changes to stress or aging? What if they're not just everyday annoyances, but early warning signs of something much more serious? Hey there, I'm Sarah Jennings, host of the Mama Method for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around pregnancy, parenting, and family planning. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're talking about 6 subtle but critical symptoms of ovarian cancer that every woman should be aware of. Why? Because ovarian cancer is often called the silent killer for a reason. Its early symptoms are easy to overlook or blame on everyday life. But missing these signs could mean the difference between catching it early and facing a much tougher road. Let's start with bloating. Now, as a mom of 3-year-old twins, Hudson and Chrissy, and with baby number 3 on the way, I totally get what it's like to feel bloated and blame it on that extra slice of pizza or maybe just hormones. But persistent bloating, especially if you wake up feeling uncomfortably full or notice your clothes fitting tighter for no clear reason, can be one of the first signs of ovarian cancer. Studies show that over 70% of women diagnosed early with this disease reported bloating as an early symptom. It's not just annoying, it's your body raising a red flag. Next up, irregular periods. And I don't mean the occasional late cycle, we've all been there. But if your period is showing up, say, every 2 weeks, or has completely disappeared outside of pregnancy or menopause, that's a sign to pay attention to. One study that followed over 15,000 women discovered that those with irregular cycles had as much as triple the risk of developing ovarian cancer later in life. Hormonal shifts that cause these irregularities could also stimulate abnormal ovarian cell growth. Another symptom many women brush off? Pain during sex. I know, it's a tough topic to talk about, especially with providers, but we need to break that stigma. If intimacy has started to feel painful, especially deep pelvic pain, it could be more than dryness or stress. Tumors pressing on pelvic nerves can cause discomfort that women live with for months before getting a diagnosis. One woman even said this was her only early symptom, and it saved her life when she finally spoke up. Fourth on the list, that bone-deep fatigue that no amount of sleep can shake. This isn't just new mom tired. I've done those 3 a.m. feedings enough to know the difference. If you're feeling wiped out every day, no matter how well you slept, and it doesn't improve, it could be more than busy life catching up to you. Cancer cells can change how your body uses energy, leaving you drained even first thing in the morning. Leg or thigh pain might sound like something unrelated, especially if you've been hauling toddlers around all day. But persistent pain, especially deep aches or numbness in only one leg, can be caused by tumors pressing on nerves in the pelvis. There was even a documented case where a young woman went 2 years thinking she had sciatica or muscle issues, until a scan revealed a large ovarian tumor. Finally, watch for changes in urination. If you're making way more bathroom trips than usual, feel the urge to go suddenly or experience discomfort when peeing, especially if these issues don't improve with basic hydration or antibiotics, it might have less to do with your bladder and more to do with pressure from ovarian growths. Now I get it. Many of these symptoms are vague and can overlap with so many everyday conditions. But if any of them stick around for more than 2 or 3 weeks, it's time to listen to your body. Just like I do when Hudson refuses dinner 3 nights in a row. I know something's off. Home remedies can help with mild bloating or fatigue, things like peppermint tea, heating pads, or adjusting your fiber intake. But if symptoms persist, those remedies should be a short-term comfort, not a way to ignore something potentially serious. Worried about your own health? Start by checking in with the Ubi Symptom Checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. If this video helped you feel a little more confident about your health, give us a like and follow for more doctor-approved info you can trust, right here from Ubi Health.